Okay, we are starting chapter 4 with personal and professional qualities of a healthcare worker, and this video is just coming on section 4.1 only. So, we are going to explain how diet, rest, exercise, good posture, and avoiding use of tobacco drugs can contribute to good health. Demonstrate the standards of a professional appearance as they apply to uniforms, clothing, shoes, nails, hair, jewelry, and makeup. So certain personal and professional characteristics, attitudes, and rules of appearance apply to all healthcare professionals. It is important to present an appearance that inspires confidence and a positive self-image. So when you go to greet a patient or see that patient, they are going to form an opinion of you very quickly. And so if you come in standing tall, look them in the eye, your clothes are nice and neat, not wrinkled, then they're going to have a better opinion of you than if you go in and you're slouched over and you look to the floor when you talk and you might whisper, or your clothes are all wrinkled. Whether you're really good at your job or not, their opinion is going to be based on that. So people tend to make opinions very quickly when they see someone. And that's also something that we need to be aware of when we see our patients, because also when we see our patients, we are also forming an opinion on them. So whether it's right or wrong, what our opinion is of them. So that is also, we can't automatically assume that maybe because a patient has Medicaid or they don't have the newest clothes that they're uneducated. It could, they could be very smart or very well educated. They've just gone through a rough time or something. So you never know. So you also need to be careful of the opinions that you make of your patients. Research has shown that within 20 seconds to 4 minutes, people form an impression about another person based mainly on their appearance. So healthcare involves health and preventing disease. Therefore, a healthcare worker should present a healthy appearance. So do you have to be fit to be a healthcare worker? No, you don't. But let's say if I go in and I smell like cigarette smoke and I tell a patient to stop smoking and they see me later on smoking, are they going to listen to what I tell them to do? Or if they smell the cigarette smoke on me, are they going to listen to me? Because I'm being a hypocrite here. I'm telling them not to smoke and I smell like smoke, so I probably smoke. So they're not going to listen to me as well. So there's 5 main factors contribute to good health. One is your diet. Eating well-balanced meals and nutritious foods provides the body with materials needed for optimum health. Eat foods from all 5 major food groups. Again, are you always going to eat healthy every day? No, probably not. Do your patients really know what you're eating outside, in private of your home? They're not going to know. But they may ask you questions about, how do you cook your vegetables, or what are your favorite vegetables or fruit to eat? And you have to be able to answer them. And they will ask you questions like that. So just something to be aware of. It's also important to get adequate rest and sleep. And that helps to provide you energy and the ability to deal with the stress that you may have on your job. The amount of sleep required for everyone is different from person to person. But if I'm seeing a patient and I'm yawning several times throughout the visit, they're going to think that I'm bored with them, or that I'm not fully paying attention, or that I'm too tired to put my best effort into their care. Or if I come in with bags under my eyes and I just look tired and exhausted, and yet I'm telling them to make sure they get enough sleep. Again, they're not going to listen as well, because they've already formed a decision about me that either I'm bored with them, or I'm tired, or I stay up too late at night, but yeah, I'm telling them to sleep. Exercise is also important. It maintains circulation, improves muscle tone, enhances mental attitude, aids in weight control, contributes to more restful sleep. It's also a way to help with stress. Exercise reduces the risk of coronary heart disease, diabetes, colon cancer, hypertension, and osteoporosis. And you want to, of course, choose an exercise that you enjoy doing and that you want to do. Again, I've told patients that they need to exercise and to do their exercise that I've given them. And patients have turned around and asked me, well, what do you do for exercise? Are you exercising? Uh, so they do ask. Um, and exercise, I think also, like I've said before, it's great for your mental attitude. Or if you have some depression, then exercise is a good way to help combat that. It's a good way to relieve your stress, maybe after a stressful day at work. So if you're able to, you should be exercising. Good posture, we've talked about this before, it helps prevent fatigue, it puts less stress on muscles. You want to stand up straight, stomach fold in, shoulders relaxed, and your weight balanced. Again, when you have a good posture, it gives an air of confidence that you have. So if you go in slunched over, head bent down, they're going to think that you're not very confident. Or if you're sitting and talking to a patient, you still want to sit up straight, because if you're slumped over in the chair, it looks like you're completely relaxed and you're bored and you don't really care what's going on in the visit. So whether if you're standing, you want to make sure you stand up straight, and same if you're sitting, you want to make sure you sit up straight and act like and pay attention to what they're telling you. Avoid use of tobacco, vaping, alcohol, and drugs. Using can seriously affect good health. Tobacco affects the function of the heart, circulatory system, lungs, and digestive system. The odor of smoke is offensive to many individuals, and secondhand smoke has proven to be harmful to health also. Most healthcare facilities are smoke-free, so you're not able to smoke on the campus at all. And there are some healthcare facilities that say you can't smoke at all, and they will do a test to see if you have any nicotine in you. And if that's the case, they will fire you for numerous reasons, because one, they're a healthcare facility and they're supposed to be promoting good health. And another is those who smoke tend to get sick more often, and so they take more sick days. So they want to make sure that their healthcare professionals are healthy and not smoking. So it's best not to start at all, because there are some healthcare facilities that will not hire you if you smoke. Avoid the use of drugs and alcohol. It impairs mental function, decreases the ability to make decisions, adversely affects many body systems, and can result in job loss. So you guys are all too young to be drinking. But if you decide to drink when you become 21, then you want to make sure you do so within moderation. Don't do it in excess, because nothing good will come out of it. It will not be any beneficial for you. You can hurt yourself and you can hurt others. And of course, don't do drugs. You don't want to do that at all at any age. So just be careful with alcohol, that when you do turn 21, if you decide to drink, that you do so within moderation. Learn the rules and standards of dress and personal appearance for the healthcare facility that you work in. It's important that you abide by the rules and make every effort to maintain a neat, clean, and professional appearance. You are representing the place that you are working for, and not only the way you dress, but the way you talk and the way you act. I made sure when I was in home care, I always wore clothes that had our home care name on it. So even I made sure that I was professional, even when I was stopping to get gas or to get something to eat someplace, that I was respectful, because people could see the name of the place where I worked at. And I want to make sure I was a good representation of that, even when I was not so-called on the job, but just stopping to get something to eat. So when you see the guys in the blue, you automatically think, hey, they're probably nurses or doctors. This lady here, she's got the flight wings on it. So you see her, and she's a pilot. An EMT is wearing his uniform. When you see someone like that, you automatically think they're a maid. And these children here, you think they're probably students at a school where they need uniforms. So what you wear, your uniforms, represents who you are, and people can tell by what you're wearing as to what your job may be. So for a uniform, you may wear scrubs. They should always be neat, well-fitting, clean, free from wrinkles. You want to make sure that they fit well, so that when you bend over, everything that should be covered is covered. Some facilities have different colored scrubs to identify the different groups of workers in the facility. So I know at Memorial, if you're a nurse, you wear blue. If you work in rehab for PT or OT, you wear green. I'm not sure what the other colors are, but each discipline has a different color that they wear. And it makes it easy for coworkers to know what your job is, but also for the patients or the visitors who come in there. If you don't wear scrubs, your clothing still must be clean, neat, and in good condition, of course. Style should allow for freedom of movement and should be appropriate for the job. Washable fabrics usually are best due to frequent laundering. So you just always want to make sure you have a professional appearance. Name badge. Most facilities always require personnel to wear name badges with photos. The badges state the name, title, and department. Some settings, such as long-term care facilities, the workers are required by law to wear a name badge. So the name badges are for several reasons. One is the security. You have your name badge, people know that you work there. Your name badge may allow you to get into certain departments or in certain rooms with your name badge. It also allows visitors and patients to know that you work there and also what your job is and what your name is if they want to know what your name is. And so there's several reasons. And if you're required to wear a name badge, again, you want to make sure you wear one. Working in home care, some people aren't too sure about letting strangers into their house, which they shouldn't let strangers in the house. So it was always important that we did wear clothing that stated our home care name on it, and then also we wore name badges so that people knew that we were safe to allow into their house. Shoes should fit well and provide good support to prevent fatigue. Low heels are usually best to help prevent fatigue and accidents. Again, if you're wearing scrubs or if you're a nurse, you're not going to want to wear heels. You're going to wear tennis shoes. But if you work at administrative or maybe coding or medical records, then you could wear heels if you wanted to. Avoid wearing sandals, open-toed shoes, or Crocs unless they are standard dress for your career. They should be cleaned daily, and shoelaces should be kept clean and replaced as needed. Again, in the healthcare field, you never know what could land on your shoes. So you want ones that can wash easily. It could be vomit, it could be urine, it could be poop even. It could be blood. So you want to make sure you wear shoes that can be cleaned easily. Personal hygiene, body odor must be controlled, so make sure you wash and shower. Maintain good body and oral hygiene. Strong odors caused by tobacco, perfumes, scented hairsprays, aftershave lotions can be offensive. So if you do wear hair products, you want to make sure you just wear just the amount that you need. If you can get ones that don't have scents in it, that's better, that don't have a smell to them. Hairsprays or, perfumes or aftershaves or colognes, it's best not to wear them because some people are very sensitive to smells. I know I am, and I can get a headache very easily if somebody has a very strong perfume on. We had a patient once, I didn't see the patient, but you cannot wear any type of scent when you went there. You can even wear deodorant. You can use, if you take a shower that morning, like if you had a strong shampoo that stayed in your hair, the smell of it afterwards, or your body wash, you could not see her. She was very, very sensitive to smells. She was not a patient of mine, but the nurses would see her very first. And then after they left her house, then they would put their deodorant on because any type of smell, you were not able to see her if you had any type of smell on you or scent. Certain scents can also cause allergic reactions in some individuals, so that's something else you need to be aware of. And when you're in home care, you get close and personal with the patient. So if you have a strong perfume on or a strong scent, they're going to smell it. And then if you get really close to them, that scent becomes even stronger to them. Nails should be kept clean, short, and natural. The picture here, she has nails that are much too long to work in healthcare. Many facilities prohibit the use of artificial nails, and that's because a lot of germs can be in them. If fingernails are long or pointed, they can injure the patients. They can also transmit germs because dirt can collect under long nails and artificial nails, and they can tear gloves. So make sure you have short nails. Colored nail polish is discouraged because the color can conceal any dirt that may collect under the nails. Frequent hand washing can cause nail polish to chip quickly and easily, and then germs can collect on the surfaces of the nails. If nail polish is worn, it should be clear or colorless. Use hand cream or lotion to prevent hands from being chapped or dry from frequent hand washing. So with the nail polish, it is going to depend on where you work. I've been to doctor's offices and they wear nail polish or the color street, which are like the nail stickers. So it's really going to depend on where you work if they will allow nail polish or will not. So again, you just have to follow your company's protocol or policy. Hair, again, should be clean and neat, should be styled and easy to care for. Fancy or extreme hairstyles, excessive hair accessories, and or unnatural colors should be avoided. So again, it's going to depend on where you work. If you can go to work with purple hair or red hair or like bright red hair or pink hair. So you have to, it's going to, again, depend on where you work as to whether or not you can color your hair those unnatural colors or not. So you have to follow their policy. If in close contact with patients, long hair must be pinned back and kept off the shoulders. Again, if you have long hair and you're bending over, because you get up close and personal with patients, if you're bending over and your hair gets in their face or on them, people don't like that. I know when I was in school, there was somebody who had hair down to her bottom, which is fine. It was fine. But if you got in line behind her at the lunch, she would flip her hair back and it would like go over your food on your tray or get in your face. So you just don't want to have that done, especially in healthcare. So you want to make sure if you have long hair that it's pulled back. You also want to keep it away from your face so that you don't have to keep touching it and pulling it back. Having your hair pulled back, again, like I said, it prevents touching the patient, falling on a tray or on equipment, or blocking necessary vision during a procedure. Jewelry, again, usually it's not permitted with a uniform. If you're wearing scrubs, it can cause injury to the patient and transmit pathogens. Exceptions include watch, a wedding ring, and a small pierced earrings or medical alert bracelets. Earrings with hoops or dangling earrings should be avoided. And again, with jewelry, it's going to depend on where you work at and what their policy is. So you just have to check with the policy to whether or not you can wear jewelry. Some, like a nose ring, a small nose ring, or a small nose hoop, can you wear it or not? Again, it's going to depend on where you work if that's allowed. Body jewelry such as nose, eyebrow, or tongue piercing jewelry detracts from a professional appearance and is prohibited in many healthcare facilities. Again, it's going to depend. Last year I had a student who had a tongue piercing, and I did not know about it until probably March that she even had a tongue piercing. So it's going to depend on where you work at as to whether or not you can wear it. Does it detract from professional appearance? Some people will say it does. Some people say it doesn't. It's just going to depend on the person and the facility as to where you work at if you can have a nose ring or eyebrow ring or tongue piercing. Limit jewelry when a uniform is not required. Excessive jewelry can interfere with patient care and detracts from the professional appearance. So makeup, you don't want to wear excessive or unnatural makeup. You want it just to enhance your natural appearance. Tattoos. Tattoos are visible and or offensive, detract from a professional appearance. Again, this is what it says in your book. You definitely don't want tattoos that are offensive that can be seen by patients. So if you do decide to get an offensive tattoo, you want it to be someplace that you can cover it up with clothing. And that's going to be the rule for almost all healthcare facilities. If you do have other tattoos that could be visible with scrubs on or with a uniform on, again, it's going to depend on the facility as to whether you can have that or not. Some facilities may say it has to be covered up. Some facilities will say that it's okay. So just something to think about when you get tattoos as to where they're at and whether or not it can be easily covered up if you get a job in which you can't wear a tattoo or if you can't have a tattoo be shown. Or it may determine whether or not you decide to take a job someplace, if it's a place that won't allow you to show your tattoos and you decide that's not the place for you, then that's your choice. So a person with tattoos and a person who has tattoos that are visible can certainly be professional. They can certainly be very good at their job. A tattoo does not make a difference in how they do their job. But it is something you do need to think about because some facilities will say that you can't have tattoos that are visible, and some will say it's okay. Maybe if you have like a small tattoo on your hand, then it would be okay. A whole tattoo sleeve, some places may say it's not. So, but you can certainly be professional, and you can certainly be a good healthcare professional and still have tattoos. Some are prohibited. Some facilities require that a tattoo be covered by clothing. Again, you just have to find out what the policies are at your facility that you work at. So again, you want to find out the rules and standards established by your agency, and you need to abide by the rules. And no matter where you work, whether it's in healthcare or not in healthcare, you want to maintain a neat, clean, and professional appearance at all times. So you want to complete the 4-1 homework, that assignment that is in Google Classroom, and make sure you contact me if you have any questions.